They say too much of anything can be harmful, but what if I told you that ejaculating every single day might actually save your prostate, boost your immune system, and help you sleep better, while at the same time quietly destroying your libido and making you more anxious and dependent than ever before? I'm Dr. Mohit Khera. For over 30 years, I've worked with thousands of men, most of them over 60, who still want to live, love, and feel like a man. And one of the most common, yet least discussed questions I hear in my clinic is this: Doc, is it okay if I'm still ejaculating every day? At first glance, it seems simple. Pleasure is healthy. Intimacy is natural. But here's the paradox, something that most men never hear from their doctor. Daily ejaculation can both heal and harm you, depending on the context. It's not black and white, and that's where most men get lost. That's why today, I'm going to walk you through 5 real, science-backed benefits of ejaculating every day, and 5 very real risks that could be holding you back, affecting your mood, your energy, and even your sexual performance. And toward the end, I'll reveal one overlooked pattern that may be silently sabotaging your confidence in the bedroom, even if everything seems fine on the surface. So stay with me, because understanding this one habit could change the way you feel in your body for the rest of your life. Before we dive in, if you haven't subscribed yet, I encourage you to hit that button and turn on the bell. That way, you'll never miss another honest, science-based health lesson made specifically for men like you. And if you find this video helpful, just type 1 in the comments. If it's not quite what you expected, type 0. I'm always listening and looking to serve you better. Let's start with the first benefit, a powerful reason many men report feeling calmer and more balanced after daily release: the surge of feel-good hormones your body naturally produces during ejaculation. 1. Boosts feel-good hormones. I've had men in their 60s, 70s, even late 80s sit in my office and quietly admit, "Doc, I don't always feel like myself lately. I'm not depressed, but something feels off." And after talking for a while, we'll circle around to the one thing they still do regularly, even if they don't talk about it: daily ejaculation. What most of them don't realize is that this one act, simple, natural, often done in private, may be giving them more than just physical release. It may be delivering something their body and mind deeply need: hormonal balance. Every time a man ejaculates, his brain releases a powerful combination of neurotransmitters. There's dopamine, the reward chemical that gives you that surge of satisfaction. Then comes oxytocin, often called the bonding hormone, which relaxes the nervous system and reduces anxiety. You also get a flood of endorphins, the body's natural painkillers that create a sense of calm and even euphoria. And don't forget serotonin, which helps regulate mood and promotes overall emotional well-being. It's a chemical cocktail that quite literally changes your mental state, often within minutes. For older men, whose hormone levels may be shifting or declining, this release becomes even more valuable. It's not about chasing pleasure, it's about restoring balance, about giving the mind a reset. Many of my patients who ejaculate regularly report that they feel less irritable, more centered, and better equipped to handle stress. It's no exaggeration to say that for some, it works better than any over-the-counter supplement or sleep aid. Of course, it's not a replacement for meaningful connection or deeper emotional work, but it can be part of a healthy, self-supportive routine. Now, you might be wondering, "That's great, Doc, but is there any benefit that helps me sleep better too?" Actually, yes. The second benefit is one that's helped countless men finally get the rest they've been craving. Let's talk about that next. 2. Improves sleep quality. One of the most common complaints I hear from men over 60 is, "Doc, I just can't sleep like I used to." They tell me they wake up 2, sometimes 3 times a night. They toss, they turn, they lie there with racing thoughts or aching joints, waiting for sleep to come. And many of them feel too embarrassed to say it out loud, but eventually they whisper something like, I sleep better after, And I always smile, because yes, I do know, and science backs them up. Ejaculation, whether through sex or masturbation, triggers a release of a hormone called prolactin. This hormone floods your system immediately after orgasm and induces a natural feeling of relaxation and drowsiness. It's your body's way of saying, "You've done enough, now rest." And it's incredibly effective. Prolactin essentially tells your nervous system to shut down the noise, lower the stress response, and allow you to drift into a deeper, more restorative sleep. But that's not the only player. Remember those feel-good chemicals we talked about earlier? Oxytocin, endorphins, dopamine? They don't just make you feel good, they actively help reduce cortisol, your body's primary stress hormone. That reduction in cortisol is essential for falling and staying asleep, especially for older men whose stress often isn't just physical, but emotional. Worries about health, family, finances, even loneliness, they all weigh heavy on the mind at night. I've had patients who, after struggling for years with broken sleep, started incorporating regular release into their evening routine, not as a guilty indulgence, but as a self-care strategy. And many of them now sleep deeper, wake up more refreshed, and feel less mentally foggy throughout the day. For men who've tried sleep aids, meditation apps, and melatonin without success, this simple, natural act sometimes makes all the difference. Of course, I always remind my patients, this is just one tool in the toolbox, but it's a powerful one, and it's built into your biology. No prescription needed, just your body doing what it was designed to do. But here's something even more surprising. What if I told you that ejaculation doesn't just affect your mind and mood, but actually gives your entire circulatory system a tune-up? That's right. The next benefit has everything to do with your blood flow, and it might be more important than you think. 3. Enhances blood flow and cardiovascular health. A few years ago, I had a patient in his early 60s who came in for a routine checkup. He was doing fairly well, staying active, eating reasonably, but his blood pressure was creeping up. We talked about lifestyle changes, walking more, lowering sodium, managing stress. Then, half joking, he said, "You know what really gets my heart pumping? Sex." We laughed, but I told him something most men don't realize. There's truth in that joke. Ejaculation, especially when paired with arousal and stimulation, sets off a cascade of physiological changes in the body. Your heart rate increases, your breathing deepens, your muscles tense and relax, and most importantly, your blood vessels expand. This process, called vasodilation, allows blood to flow more freely throughout the body. And that's not just happening down there. We're talking about full body circulation, from your brain to your feet. For men over 60, this is especially meaningful. As we age, our arteries tend to stiffen, and our circulation naturally declines. Blood doesn't move as efficiently, which can affect everything from memory to joint health to energy levels. But regular sexual activity, or even just arousal leading to ejaculation, can give your circulatory system a small but significant workout. It's like a gentle tune-up for the heart and vessels. Over time, this can support healthier blood pressure and may even help lower your risk of heart disease. I often tell my patients, your body was designed to move blood. When it stops moving, problems begin. Daily ejaculation keeps that system engaged. It reminds your cardiovascular system to stay flexible, adaptive, and responsive. And while it's certainly no substitute for walking, diet, or medication if needed, it's a natural way to maintain healthy vascular tone and oxygen delivery throughout your body. And there's another angle to this. Good blood flow is the foundation of sexual health. The same system that powers your heart also powers your erections. If you're keeping the circulation flowing, you're not just supporting your heart, you're actively supporting your sexual function too. Now, if that sounds impressive, just wait until you hear what scientists discovered about daily ejaculation and prostate cancer risk. This next benefit is backed by one of the largest long-term studies ever done on male health, and it might completely change how you think about protecting your prostate. 4. May reduce risk of prostate cancer. I'll never forget a conversation I had with one of my longtime patients. Tom, 68 years old, a retired fireman. He sat across from me during a routine visit, leaned in a little closer, and asked, "Doc, what can I really do to lower my chances of getting prostate cancer? I've lost 2 friends to it. I don't want to be next." It was an honest, vulnerable moment, and one I've heard echoed in the voices of so many men his age. What I told him wasn't a pill. It wasn't a surgery. It was something simple, something most men are already doing, but maybe not frequently enough to make a difference. I told him about one of the most surprising findings in men's health research, a large-scale Harvard study that followed over 30,000 men for nearly 2 decades. The conclusion was clear. Men who ejaculated more frequently, specifically 21 or more times per month, had a significantly lower risk of developing prostate cancer. Now, let's be honest. That number might seem high, especially for someone in their 60s or 70s. But what matters here isn't hitting a target, it's understanding the principle. Ejaculation appears to help flush out the prostate gland, clearing away cellular debris, old fluids, and possibly carcinogenic substances that could otherwise build up over time. Think of it like cleaning out the filter of an engine, keeping it from becoming clogged and inflamed. This process helps reduce stagnation inside the gland, which some researchers believe contributes to inflammation and, over time, cellular mutation. While ejaculation alone isn't a magic shield, and of course, genetics, diet, and lifestyle still matter, it's a remarkably simple act that supports prostate health in a very real way. For men like Tom, the idea that something so natural could serve as a preventative measure gave him a sense of control. That's something I always try to give my patients: clarity, confidence, and choice. And while protecting your prostate is vital, there's another benefit to daily ejaculation that most men never associate with immune strength. Yet science shows a surprising link between sexual activity and your body's ability to fight off illness. So let's take a closer look at how this daily habit may actually help keep you healthier in ways far beyond the bedroom. 5. Strengthens the immune system. Years ago, I had a patient named David, a 71-year-old widower who was healthy, active, and remarkably sharp. He rarely caught colds, never seemed to get run down, and always joked that he had the immune system of a teenager. One day during a follow-up, I asked him what he thought kept him so resilient. He leaned back, smiled, and said, "I take my vitamins, and I take care of myself in other ways too." He didn't have to say more. I knew exactly what he meant. It turns out, David might have been onto something that science is now beginning to understand. There's growing evidence that sexual activity, especially ejaculation, can have a positive impact on the immune system. When you reach orgasm, your body doesn't just release pleasure hormones. It also increases levels of certain immune factors, like immunoglobulin A, or IgA for short. This antibody plays a crucial role in defending against bacteria and viruses, especially in your respiratory and digestive tracts. In fact, studies have shown that men who engage in regular sexual activity, either partnered or solo, often show higher levels of IgA in their saliva and blood. That means their first line of defense against infection is naturally stronger. Add to that the stress-reducing effects of orgasm, lower cortisol, elevated endorphins, and reduced inflammation, and you're looking at a well-supported immune system that functions more efficiently overall. For older men, whose immune systems are already working harder to protect the body from age-related decline, this is more than just a perk. It's a form of maintenance, one that doesn't come from a pill bottle, but from within. And I've seen it in my practice. Men who remain sexually active, even just with themselves, often seem to recover faster from illness, sleep better, and experience fewer chronic stress symptoms. Now, does this mean ejaculation is the secret cure for the common cold? Of course not, but it does highlight a powerful truth. Your sexual health is deeply connected to your total health. Your immune system, your mood, your heart, they all respond to how you treat your body, including how you engage with pleasure. But now that we've covered the upsides, it's time we look at the other side of this habit, because while daily ejaculation has clear benefits, it can also carry hidden risks, especially when it becomes too frequent, too fast, or emotionally driven. In the next part, we'll explore 5 potential downsides that most men never consider, until it starts to affect their performance, their energy, or even their peace of mind. 1. It can become a psychological compulsion. Not long ago, I had a conversation with a patient named Mark. He was 66, recently retired, and living alone for the first time in decades. On paper, he was doing fine. Blood pressure controlled, cholesterol steady, still walking every morning. But as we sat and talked, he grew quiet and finally said, "Doc, I think I'm doing it too much, and I'm not sure why anymore." He was talking about masturbation, and the guilt in his voice was real. This is more common than many people think. When a man ejaculates every day, and especially if he feels compelled to do it at specific times, or feels uneasy if he skips a day, it can signal more than just a high libido. It may point to a behavioral pattern that's shifted from routine to reliance. And over time, what once felt like a natural part of life can quietly turn into something that feels necessary just to get through the day. There's a difference between enjoyment and compulsion. The first comes with a sense of choice, the second with a sense of urgency. If ejaculation becomes something you do to avoid discomfort, emotional, mental, or physical, it can begin to take on the same characteristics as any other coping mechanism. And like overeating or overspending, it can create a cycle of temporary relief followed by lingering guilt or shame. It's not about morality, it's about balance. I always remind my patients that sexuality should feel like an integrated, fulfilling part of life, not a secret ritual that leaves you feeling stuck or like you're hiding from your own emotions. When that line gets blurry, it may be time to ask, am I in control of this? Or is it in control of me? And when daily ejaculation begins to interfere with relationships, personal responsibilities, or your ability to concentrate and stay present, it's no longer harmless. That doesn't mean you need to stop altogether, but it may mean you need to step back and reassess why it's become so central to your daily rhythm. Still, not every danger is about behavior. Sometimes the real concern isn't how often you ejaculate, but why you're doing it. Many men use it to self-soothe, to numb themselves from emotional pain, grief, or loneliness. In the next section, we'll explore how daily ejaculation can become a hidden emotional crutch, and why that can quietly erode your well-being if left unaddressed. 2. It can be used as an emotional crutch. There's a moment I remember vividly. A man in his 70s sat across from me in a quiet exam room. His voice was steady, but his eyes told a different story. "I don't even think I enjoy it anymore," he said softly, "but it's the only thing that makes the loneliness go away." That moment stuck with me because it wasn't really about sex. It was about pain. For many men, especially those adjusting to retirement, grief, divorce, or the isolation that can come with aging, ejaculation becomes more than a physical act. It becomes a way to cope, a brief escape from sadness, anxiety, restlessness, or even boredom. The release brings relief, and for a little while, things feel easier, calmer, quieter. But when that relief fades, the underlying emotions remain, and so the cycle repeats. Ejaculation triggers the same brain chemicals that light up during comfort eating, alcohol use, or gambling. Dopamine, serotonin, oxytocin, they're all part of the reward system. And while these chemicals are natural and even healthy in the right context, when they're used to mask emotional pain rather than process it, the long-term effects can be quietly destructive. It becomes a kind of emotional anesthesia. The problem is not the act itself. The problem is when ejaculation becomes the primary, or only, method of dealing with life's harder moments. That's when it stops being self-care and starts becoming avoidance. I've met too many men who have gone years without telling anyone how lonely they really feel, who use their sexual release not as pleasure, but as protection from their own emotions. And what's more, the relief gets shorter, the loneliness returns quicker, and eventually, the emotional numbness can spread into other areas, into relationships, hobbies, even self-worth. That's when men tell me, "I don't feel like myself anymore." And they don't know why. It takes courage to face what you're feeling without retreating from it. And there are better tools: talking to someone, walking outside, volunteering, reconnecting with purpose. Pleasure should be a part of your life, not a hiding place from it. But emotional dependency isn't the only concern. Daily ejaculation can also have subtle physical effects, especially when it comes to something many older men are deeply concerned about: fertility. In the next section, we'll explore how frequent release might actually lower your sperm count, and when that could matter more than you think. 3. A decrease in the quantity of sperm in the semen. A few months back, I had a man in his early 60s sit down in my office with his wife. They'd recently remarried, and despite their age, they were hoping to start a family through IVF. He was healthy, active, and even joked about feeling younger than ever. But when his semen analysis came back, he looked at me with confusion. "Doc, why is my sperm count so low? I feel great. We're trying often." And that's exactly where the problem may have started. Many men don't realize that while ejaculation is a normal, healthy function, the body still needs time to produce and replenish sperm. Sperm production is continuous, but it's not instant. It can take anywhere from 48 to 72 hours for sperm reserves to fully restore. When a man ejaculates daily, especially over long periods of time, the volume of semen might stay relatively consistent, but the sperm concentration within that fluid tends to drop. Now, for most men in their 60s, fertility may no longer be top of mind. Many are past the point of wanting children, or perhaps their families are already grown. But for others, like my patient, it still matters. Whether they've remarried, are using assisted reproductive methods, or simply want the option to conceive later in life, frequent ejaculation can quietly reduce their chances of success. It's not about abstaining completely, it's about spacing things out. For men trying to conceive, I often recommend allowing 2 to 3 days between ejaculations. This gives the body time to build up not just volume, but quality, higher sperm counts, stronger motility, and better chances of fertilization. Even if you're not trying to have children, this point still speaks to something deeper. Our bodies respond to rhythm and balance. When we push too hard, even with natural behaviors, the systems that support us can begin to strain. Sometimes it's not just how much we do, but how often and with what purpose. And as we talk about balance, there's another side effect of daily ejaculation that often catches men off guard, one that doesn't affect sperm or hormones directly, but your desire itself. If you've ever found yourself feeling less interested in sex despite frequent activity, the next point might explain why your natural spark has started to dim. Let's take a closer look. 4. Reduced libido over time. Several years ago, I had a patient named Gerald, 67, retired school principal, proud grandfather, and by all accounts a healthy man, but something had changed. He looked at me one afternoon and said, "Doc, I still go through the motions, but I don't feel that spark anymore. I used to look forward to it. Now, I don't know. It feels automatic." That honesty struck me deeply, because behind those words was something many older men never say out loud. They're doing everything right, but the want to is fading. Libido isn't just about testosterone levels or physical health. It's about desire, anticipation, the quiet electricity of looking forward to intimacy. But when ejaculation becomes a daily habit, especially out of routine, stress relief, or even boredom, something shifts. The brain's reward system, which thrives on novelty and contrast, begins to dull. When dopamine is triggered too often in the same predictable way, the brain starts to respond with less intensity. What once felt exciting becomes muted. This is known as desensitization. Your brain simply stops reacting to what used to light it up. And for many men, that shift happens so gradually, they don't even notice it until they've lost interest in sex with a partner or feel disconnected from their own arousal. The body still works, but the mind is somewhere else. It's important to understand that this doesn't mean something is wrong with you. It just means your system needs a reset. I often recommend a short break, a few days, sometimes a week or two, just to let the brain recalibrate. During that time, engage in touch without expectation, rediscover connection, or even revisit old memories that once stirred desire. You'd be surprised how quickly the spark can return when you give it space to breathe. And there's another factor at play here, something that doesn't just affect desire, but performance. Because when ejaculation is rushed, repeated, or done out of habit rather than connection, it can begin to condition your body for speed, not endurance. In the final section, we'll talk about how daily ejaculation, especially through fast, repetitive stimulation, may contribute to premature release and even impact your ability to stay firm when it matters most. Let's break that down next. 5. Contributes to premature ejaculation and erectile dysfunction. Not long ago, a man in his late 60s, let's call him Wayne, sat across from me, fidgeting with the zipper on his jacket. After a long pause, he said, "Doc, I don't know what's wrong with me. When I'm alone, I finish in seconds. And with my partner, it's even faster. Sometimes I can't stay hard long enough for anything meaningful to happen. It's embarrassing." His voice cracked on that last word. What Wayne was describing is something I hear far more often than most men realize. Ejaculation, like anything in the body, follows patterns. When you train your body, day after day, to climax quickly, your nervous system learns that rhythm. Over time, it becomes conditioned, and especially if you masturbate fast, with little buildup or variation, your body adapts to that pace. It's like training for a sprint instead of a marathon. The result? When you're finally in a real, connected moment with someone else, your body reacts on autopilot and often too sad. The same habit can also chip away at your confidence. If you start worrying about whether you'll last long enough, that stress alone can trigger performance anxiety. And when the mind becomes anxious, the body often follows. You might notice trouble getting or keeping an erection, not because anything is physically broken, but because fear has quietly taken over the moment. It becomes a cycle. Rush, finish, frustration, repeat. And the more often it happens, the harder it is to break. Many men then avoid intimacy altogether, not because they've lost interest, but because they're afraid they'll let their partner down. That fear can be devastating, not just to the relationship, but to a man's sense of self-worth. But here's the good news. This cycle can be reversed. With time, patience, and a few changes in how you approach stimulation, you can retrain your body to respond differently. Many of my patients are shocked by how much better things get once they slow down, reconnect with intention, and give themselves space to relearn pleasure in a more balanced way. Now that you've seen both sides of this habit, the benefits and the risks, you might be wondering, where's the line between healthy and harmful? And how do you know what's right for your body? In the final part, I'll walk you through a simple way to find your balance and share a powerful insight that's helped thousands of men feel more in control, more connected, and more alive. Let's wrap it all up. Conclusion: finding your own balance. If there's one thing I've learned in over 3 decades of working with men, it's that no two bodies and no two lives are exactly the same. What brings one man relief may bring another man stress. What helps one stay grounded may leave someone else feeling disconnected. That's why when we talk about something as personal as daily ejaculation, the answer isn't black or white. It's not about right or wrong, it's about finding your balance. We've covered a lot here today. On one side, we've seen that daily ejaculation can offer real, measurable benefits. It can lift your mood, help you sleep better, support healthy blood flow, reduce your risk of prostate cancer, and even strengthen your immune system. For many older men, especially those navigating life alone or managing stress, that release can be both comforting and revitalizing. It can feel like a return to something familiar, something that reminds them they're still very much alive. But on the other side, we've seen how that same habit can quietly become a crutch. It can slip into compulsion, numb out difficult emotions, lower sperm quality for those still considering fatherhood, dull the desire for real intimacy, and even rewire the nervous system in ways that make lasting performance more difficult over time. The very thing that once brought relief can, if left unchecked, create its own source of frustration. So where does that leave you? That's the most important question, because the answer doesn't come from me, it comes from how you feel in your own skin. Does your daily routine leave you feeling relaxed, rested, more centered, or do you feel drained, disconnected, maybe even a little ashamed afterward? That's your compass. Your body is always giving you signals. The challenge is learning how to listen. And if you're not sure where to begin, I'll leave you with this. Take a pause. Not because anything is wrong, but to check in with yourself. Slow down. See how your body responds. Explore what it feels like to choose rather than react. You might be surprised at what comes up. You're not broken, you're not too old, and you're not alone in any of this. You're a man in motion, still learning, still adjusting, still becoming. And that, in itself, is something worth honoring. Thank you for spending this time with me today. I hope it brought you clarity, encouragement, and a deeper sense of connection to your health, your choices, and to yourself. If this video gave you something to think about, if it helped you feel a little more informed, more confident, or just more understood, I'd be truly grateful if you gave it a thumbs up. It might seem like a small gesture, but it tells YouTube this kind of honest, health-focused content matters, and it helps more men like you discover it. Feel free to share this video with someone in your life who might benefit. A friend, a brother, a partner. Sometimes the most important conversations start with just hitting send. And I'd love to hear from you. Was there something in this video that really resonated? Or maybe something you still have questions about? Leave a comment below. I read everyone, and I always do my best to respond and guide the conversation in a meaningful direction. Lastly, if you believe in the mission behind this channel, if you'd like to support the work I do in making content that's real, respectful, and rooted in science, consider making a small donation. Every bit helps me keep producing videos without outside pressure or sponsorships. You'll find the donation link below. Thank you for your trust, your time, and your willingness to keep learning. We're in this together, and I'm honored to be a part of your journey. Stay curious, stay strong, and take care of yourself.